Hello, my name is Brandy Lee, and my son Finn was treated for rhabdomyosarcoma here at Mayo Clinic. In this video, I will give you some advice regarding how to choose a rhabdomyosarcoma surgeon for you or your child. Keep in mind that this list is not all-inclusive and that treatment plans will be different from patient to patient. At the end of the video, you will see some instructions on how to obtain a consultation or second opinion for you or your child here at Mayo Clinic. The most important aspect of this surgery is finding a skilled or experienced surgeon who has a lot of experience dealing with rhabdomyosarcomas. These tumors can be very aggressive, and there is usually just one chance to get this surgery right to ensure that you or your child have the best possible chance for a positive outcome and to minimize the chances of having a recurrence or complications after surgery. A recurrence with this disease is extremely difficult and sometimes impossible to treat, so it is very important to have surgery done right the first time. Be prepared, do your research, and write down questions you want answered. You should make sure that the research you're doing is coming from reputable sources and is not outdated. If you are concerned about something you read, ask your surgeon about it during your consultation. You should write down the answers that you receive from the surgeon or bring someone with you to write down the answers for you so you can refer back to them later. You're going to receive a lot of information during your consultation, and it is easy to forget what the surgeon told you, and it is nice to be able to have something to refer to at a later date. Most surgeons won't mind being recorded in order to have you remember details about the consultation. Just please ask before you do so. Be your own best advocate or your child's best advocate, and do not be afraid to ask questions. You are interviewing this surgeon to perform a job or service for you or your child, arguably one of the most important services of your or your child's life. You have every right to ask as many questions as you feel are necessary to help you make an informed decision about your care or your child's care. You should not let a physician make you feel like you can't ask questions. If they do, there is nothing wrong with ending the consultation and walking out. If you're not sure about the surgeon's experience level or are not satisfied with the answers that you are given, you should get a second opinion or multiple opinions if needed. A good surgeon should not be offended if you ask about their experience level or ask how many rhabdomyosarcoma surgeries they have performed. You need to trust your surgeon, as they will have to make many decisions on your behalf or your child's behalf during surgery, and you need to feel confident that they have the experience and ability to make the best decisions. If you or your child are having a diagnostic test and are confused or concerned about why you or your child are having the test, ask your physician why the test was ordered and what they are hoping to learn from those tests. You should have all of your questions answered in advance, and you should know the surgical plan. You should know what will happen under different potential scenarios that the surgical team may find. We all fear the unknown, so knowing the exact surgical plan and what will happen along the way will help alleviate the pre-surgical stress and uncertainty. Rhabdomyosarcoma can involve multiple organs or organ systems. A tumor in the abdomen may involve the intestines, the liver, major blood vessels, bone, or other organs. Ask your surgeon if there is a multidisciplinary team at their institution. A multidisciplinary team would involve different surgical experts in each body part that is involved by the tumor. For the above scenario, this would involve sarcoma experts in intestinal surgery, liver sarcoma surgeons for the liver, vascular surgeons for the blood vessels, sarcoma orthopedists for the bone, and other surgeons that specialize only in the involved part. Having this sort of surgery is similar to building a house. To build a house, you need carpenters, roofers, electricians, plumbers, painters, etc. You would never have a plumber do your roof in a house, so why not have the most specialized and qualified person operate on the organ or organ system they have dedicated their entire career to? This includes the surgical pathologists. There should be a dedicated rhabdomyosarcoma expert in pathology available to review surgical specimens in real time, since this can have major effect on outcomes. Some rhabdomyosarcoma surgeries will require specialized reconstruction after surgery by a plastic or reconstructive surgeon. You should discuss you or your child's particular situation with your surgeon. You should discuss your reconstruction options with your surgeon and have them explain why they are using that particular method. You should ask your surgeon for an aftercare plan so you know what to do once you or your child go home after surgery. You should know the difference between a normal side effect versus a complication that needs medical attention and have a plan in place to deal with any potential complications. If in doubt, ask your surgeon. You should discuss realistic recovery timeframes with your surgery team so you know if you need to ask for help from family and friends and for how long. It will also help you set up realistic expectations for when you or your child will start to feel close to normal again. Prior to any post-surgical appointments, you should read you or your child's operative and final pathology reports and write down any questions that you have about those reports to ensure that you understand what happened during surgery and understand the final pathology report. If you do not understand something in the reports or do not understand some of the medical terms, you should ask your surgeon to explain them. You should join a support group if possible. This is a stressful and overwhelming process, and it is very helpful to talk to people who have been through this process because they are in the best position to know how you are feeling and to provide you with information about what to expect from the surgery. It is very hard to explain to people who have not been through this process how scary it can be. It is also helpful to hear from people who have successfully made it through this process. There are various support groups available online and through social media sites. Family members need to understand that this is a stressful and highly emotional journey for the patients and parents. This is a major surgery with a lot at stake. On the flip side, patients and parents must also realize that this may be very scary for their family as well. Having as much information about the tumor, understanding the surgical plan, understanding the treatment options, and understanding what to expect after surgery will help alleviate everyone's fears and concerns. If you select an experienced and skilled surgeon, they will do everything that they can to provide you or your child with the best outcome. The best thing that you can do is get you or your child into the hands of an experienced surgeon and have this tumor removed as soon as possible. Do not watch and wait because you are afraid to have you or your child undergo this surgery. It is important to have this tumor removed while it is still removable. People in support groups regularly ask how they will know if their surgeon has the experience and skill level required to perform this surgery. You can learn that through the questions that you ask and by listening to the responses from the surgeon. It should become clear during those conversations that the surgeon has enough experience to handle you or your child's particular situation. I am asked all the time why I selected the Mayo Clinic when I interviewed multiple surgeons. These are the reasons that I selected the Mayo Clinic Rhabdomyosarcoma team, and these are the things that I think people should consider when they are selecting a surgeon. I like the fact that our treatment team thoroughly answered all of my questions, and their answers were always based on facts, research, and their extensive experience performing this surgery. I also like the fact that our surgeons would listen and would take what I had to say into consideration when deciding the best course of action for my child and I. They explained exactly why they were recommending a certain course of action and explained why they would or would not do something. I liked our team's candor. My husband and I are direct, honest people, even if what is being said is sometimes difficult for people to hear, and I appreciate those qualities in other people. I would rather have a surgeon who calls a spade instead of someone who sugarcoats things because they think that is what the patient or parent wants to hear. They demonstrated to me that they were willing to improve and change their surgical processes over time if they found a better way of doing things, whereas other surgeons just used the same old techniques for years because that was the way that they had done this surgery. I did not like the one-size-fits-all approach, and I wanted a surgeon like Drs. Gargorio, Gramberg, and Rose, who would use advanced technology and techniques, and who would develop the best surgical plan that was individualized to my son's situation. I like the fact that our surgeons used subspecialists of different parts of his surgery. Dr. Rose did all of the orthopedic work. Dr. Leibovich, the chief of urology, performed the extensive lymph node dissection. Dr. Potter did all of the colorectal work, and Drs. Gargoglio and Granberg did all of the tumor removal and urinary reconstruction. They also had a vascular surgeon and plastic surgeon standing by in case they were needed. No other center had that, and we interviewed with some of the best centers in the country. I also wanted a surgery team who was very experienced in handling rhabdomyosarcoma, since these tumors are very rare and most surgeons have never even seen a case, let alone operate on people with rhabdomyosarcoma from all over the world. Our team had a plan for every scenario, and I knew exactly what would happen under each scenario. Because of that, I was afraid before surgery, but I knew my son was in the best hands. It was the one thing that really helped me get through this process. I have had many more questions after I originally was put in touch with the rhabdomyosarcoma team here at Mayo. I exchanged a lot of emails and phone calls. They always responded to messages, texts, and phone calls right away, even after hours or during the weekends. I certainly did not expect them to respond after hours or during the weekends, but the fact that they did demonstrated to me that they sincerely cared about my son and his care. It is one of the things that truly sets them apart, and it is what makes them an outstanding team. Thank you for your time and for listening. I hope that this video helps you in yours and your child's journey.